Communities should take the lead in the fight against the HIV/AIDS epidemic. That's the message from Deputy President Paul Mashatile. He's also called for the protection of adolescent girls as the latest stats show they're vulnerable to infection. Mashatile was addressing the official World AIDS Day event in KwaZulu-Natal earlier.
There is reason for concern about the increased incidence of HIV infection amongst adolescent girls aged 15 to 19, since it is an indication that older men engage in unprotected sexual activities with young girls and young women. We must take extraordinary measures as society to protect our children against immoral predators. We must ensure that children have a safe environment to discuss issues influencing their sexual conduct and the pressures they are under. We must stand with them and educate them about their rights and sexual health. Furthermore, while acknowledging the significant advance in HIV treatment cascade at a broad level, our deepest concern persists regarding the lack of access to treatment by HIV-positive children, young people and young men. The survey shows that in 2022, among the people aged 15 years and older who were living with HIV in South Africa, 90% of them were aware of their status. 91% of those who were aware of their status were on antiretroviral therapy, and 94% of those on treatment were virally suppressed.
Our reporter, Vusi Kumalo, earlier spoke to UNICEF at the event.
It's the World AIDS Day today, being commemorated worldwide. As you know, that's worldwide there are about 39 million people who are living with HIV, and here in South Africa being the largest carrier of that, with the biggest population at almost 8 million people who are living with HIV in the country of South Africa. And then again here in KwaZulu-Natal, as we are here in Mandeni, the province of KwaZulu-Natal also has got more than 20% of its population who are living with HIV, and also being closely followed by the provinces such as the Free State as well as the Eastern Cape. Well, we've got the UNICEF as well, which also provided a message of support in the statement. They were also here to deliver that message just before the Deputy President of the country, who is leading the World Day commemoration there, took to the podium. So we've got Christine Huigana, who is from the UNICEF, because they've just launched the Global Alliance, which is, its aim is to ensure that by 2030 they do end AIDS in children. Let us engage here so that we can just to ask her about the targets, if this is achievable for you, as we have just launched the Global Alliance in ensuring that by 2030 you do end AIDS in children. How achievable are those targets?
We are in a situation today where, although 90% of the adults in this country know their HIV status, they have access to treatment up to 90%, and their viral load is in control. But for children, it's not the case. In this country, we have 82% of the children who do not know their status. We have 68% of those children who should be eligible to treatment who do not have access to treatment. So we are saying if it's possible for adults to be on treatment up to 90%, and the 95% that's the target that we would like to reach, children should have access to treatment and being virally suppressed. It's possible, and we need to do it, and that's what today is about. It's a commitment from communities, from families, from civil society, but also from the public sector, from partners like us, to say this is unacceptable and children should receive all the treatment, the care that they need, that they require, that they deserve.
I know that 12 countries already have signed, they've also launched their global alliance. How easy was it in other countries? Because you can see South Africa being the biggest carrier of HIV worldwide, but it's the one that has just launched it.
Right, South Africa just launched it. That doesn't mean that we haven't been working, we haven't been reaffirming our commitment to work towards this important goal to end AIDS in children. So to me it's not a matter of it being easy or not. It's an obligation, and all the 12 countries in Africa where the burden of HIV/AIDS is heavy, is high, are committed to do this, and we are here as the United Nations system, as UNICEF, to make sure that by 2030, if not before, we end AIDS in children.
What is it that South Africa is perhaps not doing well? Because we still have just a small number of people who are perhaps using condom, if I may say so. There's a big drop in condom use, and also a high prevalence of HIV amongst young children and women. What is it that you are doing wrong as South Africa that UNICEF can play a role in terms of helping South Africa reduce these levels?
This is what this plan of action for South Africa is exactly trying to do, is exactly saying we would do. We need to put emphasis on finding those children in the community who are not on treatment. We need to put emphasis on the vulnerability of young girls who get pregnant, who are violated, abused. We need to make sure that the prevention of mother-to-child transmission in young women through breastfeeding is under control through treatment of the women. And then to your specific questions, we need to make sure that we address the social barriers that make young women, children more vulnerable than they should be. They're poor, they live in societies and communities where violence is prevalent. So those are the things, the most difficult ones actually.
Okay.
Those are the ones that we need to address.
Okay, thanks a lot for your time. Okay, that's Christine Mohikana, who is coming from UNICEF, was also providing a statement or support message here as we celebrate or commemorate the World AIDS Day here at Mandeni.